really excited about the partnership that we have, because I think it's a unique opportunity for two large organizations to really benefit communities in a very positive way. So thank you for participating in that and being a partner with us.
This new partnership is a really spectacular way to showcase, I would say, what is best about HCA Healthcare and what is best about American Heart Association. Our shared commitment to health equity, our commitment to excellence in clinical care, our commitment to our communities, and how we bring that all together will really be showcased in our new initiative.
We, very simply put, felt that there was a need for better collaboration between neurologists and cardiologists and those care teams to not only prevent first strokes, but really get deep to understanding what the cause of a stroke is and get those patients back on the road to health and hopefully prevent a second stroke in the process.
Looking at the nexus between how cardiology and neurology are working together to do two things, really. Look at the patient stroke diagnosis and ensuring that we're finding out what is the root cause of the stroke and really reducing the number of patients that are discharged with an unknown etiology of stroke.
And at the same time, helping collaboration with our own care providers, both in neurology and cardiology, as well as even national professional education that will hopefully take what we learn and not only expand that across HCA Healthcare's markets, but across the United States and share that knowledge with the rest of the scientific community.
When we designed this partnership, we realized we wanted to both advance our shared commitment to health equity, so it's at the center of all we're doing together.
The common topic we're focused on, looking at patients and community and what they really need the most in order to be able to remove any barriers in their care. So we're looking forward to, in this partnership, really working on the connection between heart and brain, and at the same time thinking about the social determinants of health that our community members are struggling with and those patients who need even more support in order to live healthy lifestyles might need.
So together with AHA, we are working to improve health equity through policy, through systems, and through environmental changes. For example, one of the systems changes is we're doing food security assessments at the time someone comes into a clinic or at a community setting. And then based on that assessment, we'll refer them and to accessible foods, whether that's fresh food through a food market or a mobile food pantry. These policy systems and environmental changes will endure beyond the partnership.
What we're working on is really making sure that patients who come in and present with a stroke have the right workup and understanding of where they're going to need to go next in their clinical journey to really understand what was the cause of that stroke and what type of treatment do they need to have in order to make sure that they don't have a reoccurring stroke.
So through this collaboration, we not only wanted to make a financial investment, but we really wanted to amplify that investment through intentional leader-to-leader connections. So we're involving our physicians, we're involving our division leadership, we're involving everyone at HCA together with everyone at AHA.
Understanding not only those risk factors for stroke like hypertension and diabetes and being overweight and inactivity and smoking, but also understanding that treating those conditions can help dramatically reduce your risk of a first stroke.
We have more than 40 partners presently, and that number is growing. And if we look at policy systems and environmental changes, we are well over 90 policy systems and environmental changes in the partnership, and that's just in the first year.
I'm thinking that maybe we're doing something here that's got a lot of potential.
I think you're absolutely right, and it will be an amazing journey together. And again, we're so grateful to you for your partnership and that of your wonderful team of people at HCA.
Well, likewise. Thank you.